Welcome to Queen's General Surgery. We've put together this video to give you an insight into our residency training program and what you will experience in this program. People always ask the program director, so what qualities are you looking for in a general surgery resident? And for our program, because of the nature of it, we're looking for people who are humble, who are compassionate, and also who can work well in a team. And if you think about those qualities, they're the qualities that you need to be a general surgeon. When you start your residency here, you'll start in surgical foundations and you'll experience a number of off-service rotations, as well as your core general surgery rotations. The off-service rotations might be ICU, vascular surgery, emergency medicine, and residents absolutely love vascular surgery because they get so much autonomy. You'll also spend time in the ICU. Our core surgery rotations are colorectal, hepatobiliary, surgical oncology, which is also associated with pediatric general surgery. Somewhat different to other programs, our pediatric general surgery is a longitudinal exposure. So if you're on that service as a PGY1, you'll also see that service as a PGY5. Then there's our acute care service, which we call CTU4. CTU5 is endoscopy. And then we have CTU6, which is bariatric and foregut surgery. So as you progress through your year, you'll see these rotations at least 3, if not 4 times. So again, you build on your skills each time you're on the service. I think most people are aware now that we have a high robotic program, high-level robotic program that sits in colorectal surgery. And over time, I can see this expanding further into other services such as hepatobiliary and surgical oncology. When you walk into this program on day 1, you'll know the faculty and they will know you. You can't escape in this program, which means that your training is very fluid and allows progression of your skills throughout the program because you don't have to wait for the faculty to relearn what stage you're at.
The colorectal program here at Queen's is divided across 2 locations. Here at Kingston General Hospital, we have the highest volume robotics program in the country. And we also get exposed to core laparoscopic skills and open skills, both on the elective service and on call. Those laparoscopic and open skills are then also reinforced at our Oshawa Community Center, in which we participate in complex laparoscopic and open surgery there as well.
My name is Dr. Nanji, and I'm a transplant and hepatobiliary pancreatic surgeon here at Queen's. We, like many HPB programs across the country, see many complex cancer patients and spend many hours in the OR doing long and intricate surgical cases. We also work with many other specialties, such as our colorectal colleagues, and operate on patients with colorectal cancer with simultaneous liver metastases. More recently, we've embarked on robotic training in the hepatobiliary domain to try to incorporate robotic resections as part of our HPB service. Renal transplantation is also part of our service, including deceased donor and living donor transplantations. In addition to my clinical practice, I'm also the director of the Global Surgery Program. The aim of this program is to reduce global disparities in access to surgical care, predominantly in low and middle income countries.
I'm Dr. Merchant. I'm a surgeon on Clinical Teaching Unit 3, which is a combined unit of pediatric surgery and surgical oncology. From an oncologic standpoint, we perform assessments and manage a wide variety of common and uncommon breast, skin, soft tissue, and gastrointestinal malignancies. We also regularly provide input at local and provincial multidisciplinary tumor boards, which we expect our residents to join and learn from, as this is a really nice venue to discuss the management of complex cancer cases. We try to be really thoughtful about engaging our junior residents in the operating room at an early stage so that they are building those foundational skills throughout their learning. You may also be wondering about research opportunities within the Division of General Surgery. The research opportunities are abundant, and as a group, we are quite productive.
My name is Dr. Boris Evan, and I'm a clinical service lead for CTU6 within the Division of General Surgery at Queen's University. Our clinical teaching unit is focused predominantly on metabolic and bariatric surgery, surgery for the benign disorders of the upper gastrointestinal tract, hernia surgery, and complex abdominal wall reconstruction. You're likely wondering what are some of the exciting projects and areas of educational scholarship that we're currently working on. One area that we're exploring actively is the use of video recording from the operating room to try and help learners with improvement of their technical skills. And down the road, we're also looking at strategies to improve the non-technical skills.
Here at Queen's, we emphasize early and extensive endoscopy training here for our residents. We're one of the few programs in the country who initiates endoscopy training as early as a PGY1. In fact, we're the only program in Ontario who sends our PGY1 residents to an endoscopy boot camp in their first 2 weeks of residency. So my experience on endoscopy has been great. We scope 5 times per week, with 2 of those days are dedicated to a high volume community setting where we're doing upwards of 10 to 15 scopes per day.
When I was first starting at Queen's, I felt some concern about whether we would get enough access to trauma, just because it's a smaller center and it's between Toronto and Ottawa. But I was very happy to be proved very wrong. Not only do we get lots of trauma exposure through the longitudinal nature of our rotations, where you're doing trauma rotations from R1 to R5, but also the volume is significant enough, and the fact that there are no fellows or other people who are kind of between you and the operating table means that you get a ton of exposure and a ton of operating time. There are multiple great things about our Team 4 acute surgery team. It's great to work with multiple staff, so each staff has a week on and then you have somebody new to work with and new skills to develop. You also have this longitudinal experience right from the beginning of R1 to the end of your training. We have lots of different high acuity cases with very high autonomy and responsibility, so you are running the service, the buck stops with you.
One of the things that I always talk about when it comes to Queen's General Surgery is how I really like the fact that you kind of have the best of both worlds. On the one hand, you have access to those big, larger, more complex cases, you know, the multivisceral organ resections, access to robotic, complex colorectal surgery, really cutting edge oncological care. But at the same time, you have that smaller program feel. You're working with a very close, tight group of residents. You're working with faculty that know you. And one of the things that lends to is greater access to the OR and greater access to gaining more independence in your operative skills.
One of the real advantages is our senior resident ORs and our senior resident clinic, where we basically, with supervision, get the opportunity to experience what it will be to be an independent practitioner. Figure out some of the bumps in the road, figure out how you want to run your practice so that by the time you're launched into the world, you know, you have a sense of what you're doing.
It can feel a little bit challenging, daunting, but we are expected to take care of high acuity patients and step down ICU patients from the start of our residency. And so we have that early exposure to ICU, and I feel very well equipped to transition to hopefully night float and senior in this year after that ICU block especially.
We are literally as you can see behind me, a 5-minute walk from Kingston General Hospital. It's a super lovely area. One of my favorite things in the morning is that when I'm in at like 5:30 a.m. to round on the pediatrics floor on Kid 10, I get to see Lake Ontario as I'm seeing my patients, and that's a bonus, I think, that isn't offered anywhere else.
A lot of the residents actually live about 5 to 7 minutes away from the hospital, either walking distance, driving distance, or biking distance, which makes a huge difference in terms of your morning routine and how much sleep you can get, which, as we all know, as surgical residents, is very, very precious. Every minute counts, as we like to say.
One of my favorite things to do after a rough 24-hour call, no sleep, tired, we still have managed to yet take the time that after we're done our work shift, we would go and actually celebrate our call shift together with brunch.
This training program at Queen's will offer you a wealth of experience, a lot of complex cases. It will train you to be a community surgeon if that's what you want to do. It will prepare you for your fellowship. Having spent some time now looking at the program, it's probably time that you should think about, is this a program that attracts you? Is it a program that you think you could spend time in and you would be comfortable training in this program?